Hello? Kounya li bon, kounya m'tande. Tale la. Non, bon, ma pala ou kon ma fait tande. Les trois téléphones gen, bon m'tande sur l'autre là. Bon m'tande sur téléphone ça, YouTube. Ma ale tout fois pas dans live là m'bakari. Oui. Allez. Bon, on 10 minutes, 20 minutes après ça m'a fermé. Hey guys, comment nous y est? Okay, so pour moun qui t'a demandé, guys, for some of you were asking me, so vamos voir aller parce que vous pas être dans live moi. M'bral lante ou tale. So guys, for some of you were asking me about my book. So this is how my book looks, okay? For example, let's say you are doing ALS, okay? This is, so you see the definition and the pathophysiology, the cause, risk factors, complication. So all diseases can be diagnosed, and Nclex priority, signs, symptoms, nursing intervention, treatment, and patient teaching. Okay, so if you are a visual learner, this is the best book. This is the best book for you. Okay, so how you can get this book? You can go at careforallcadou.com. So however, my phone number is 941-288-0745. If you have Zelle, I take Cash App, guys. Okay, so this is how you're gonna get your book. And let me check another disease for you. I can show you. So that's mean if you're having a difficulty to remember your stuff, this is the best book for you. Okay, let me pick this one. Let's say, what is this? Okay, let me pick pericarditis. Okay, I just pick up this one. You see my book, guys. Okay, let me remove this for you. Okay, so this is about pericarditis. Okay, so it just show you guys how diseases progress, and this is the complication. You cannot miss this when you go write your Nclex exam. Okay, especially if you are a visual learner, this is the best way for you can learn stuff, guys. So this is what happened about pericarditis, diffuse ST elevation, inflamed pericardium, and shortness of breath, low-grade fever, fatigue, malaise, blood pressure, monitoring. Okay, just tell you to what you're supposed to do as a nursing intervention. Dizziness, anxiety. Beside that, let me pick up another disease. So let me pick which one I can pick for you guys. Let me pick. Okay, let me pick Alzheimer. Okay, let me pick Alzheimer. Okay, this is Alzheimer disease, and I can remove this one. Okay, this is Alzheimer. Let me make it smaller, guys. Okay, this is about Alzheimer's disease. Alzheimer's disease is a degeneration brain disorder causing progressive memory loss, cognitive decline, and personality changes. And beside that, you see inside my book, the way I make my book, guys, I put the picture. You can see what happened inside the brain and what are the causes and risk factors. Age, over 65, family history, genetic factor, chronic disease, hypertension, diabetes, head trauma, and Down syndrome. So what about signs, symptoms? You need to know them, the signs, symptoms, and also causes and risk factors, because sometime in your Nclex exam they can ask you select all that apply, what are the signs, symptoms, and then if they are indicated, so you're gonna select them. If they are not indicated, you don't need to select them. And which select all that apply, you're gonna choose all the positive answers. Okay. Signs, symptoms, so amnesia, memory loss, okay, and aphasia, language loss, difficulty talking, and agnosia, unable to recognize face and object, behavioral changes, agitation, and and more. And any disease you study, there is a way they can diagnose this disease, guys. Okay, there is a way. Any type of disease. Okay, so they can do that. MSE and CT, MRI. Okay, rule out other causes of dementia, and these are the complications of Alzheimer. Okay. So sometimes you see your patients wandering, injuries, malnutrition, because the patients don't even remember when to eat, and patients not really eat enough food, guys, that the body requirements. And sundown, agitation, worsen at night. Okay. Nclex tip you need to know for each disease. These patients need safety all the time. Okay. Secure the environment first for your patient. Use simple, clear instructions are best for your patient. Do not rush or force ADL. Let's say if your patient suppose to take shower and patient refuse, you can try to see if patient's gonna be comply to receive care. But if patient's not comply, so you cannot force your patient, guys. Okay, you can just document. This is my website, so if you need to buy the book, you can go online right now at Cadou.com, or you can contact me directly at 941-288-0745. I do speak French, I do speak Creole, English. If you need to communicate with me, guys, so have no problem. You can speak Creole, you can speak French, or you can speak English. So si ou bezwen liv lan achè ou son moun ou toujou gan pil difficulté, ou ba jam ka pase Nclex, so liv lan li available dans careforallcadou.com. Okay? So this book is available at careforallcadou.com. Otherwise, you can contact me directly at 941-288-0745. Okay? So wap jen liv la chen na website mwen. But sou son moun ou vle relem directement, ka relem nan 941-288-0745, ou ka peye via Zelle or Cash App. Okay? Let me find something else for you guys. Okay, find one more disease. And this is very important, guys. If you are study, Where's my other thing I put here? Come on. I'm gonna try. Okay. And also, guys, this is for the review. So the review will be started on April 15 to from April 15 to August 15, 2026. Let's say if you go, you already, like, you know, when you write your Nclex exam and then you didn't pass more than 2-3 times. So even one time, okay, only go one time. So you need to stop doing that. Say, okay, let me see what make me did not pass the exam, what I need to review more. Don't say, like, you know, you are looking only which area you were like a below. No, you need to review everything. You start from head to toes. You start from all your nursing fundamentals. So what happened to some students, sometimes they just look at the below reports, below mark, and then they just say, you know what, I'm gonna just review only my below notes note. You need to review everything for your Nclex, okay? And when you are studying, you need a little bit notebook. You can take some notes, and then even you are doing questions, you need little notebooks to take your own notes. And after, when you're done, you can review your notes, guys. Ok? So, besoin de cahier pour capable prendre notes pendant que vous faites review, pendant que vous faites question. Ok? So, and then l'on fini, vous doit retourner sur yo et puis pour capable review notes ça que vous te prend. Ou capable enregistrer en ligne. You can register online right now at careforallcadou.com. So it's on my homepage. So de vous pas être dans première page là ou après to register now. Okay? careforallcadou.com. Please do not memorize. If you are a memorized person, you don't even have to register, you don't even have to call me. I need like students who really, you study smart, you understand what are you studying. And the biggest issue with you guys, you don't even know the pathophysiology for each disease. Because if you don't know the pathophysiology for, like, you know, the disease, so how come you're gonna answer your Nclex questions? Even Nclex not gonna ask you about what is the pathophysiology. For example, for Guillain-Barré, they're not gonna ask you, but you need to know the pathophysiology. So the manifestation. As soon as you know your stuff, the causes, pathophysiology, risk factors, signs, symptoms, nursing intervention, and then what is the priority for this disease, then you will be fine. But if you just study, you just memorize, this is not a good idea for you. So you need to change the way you are studying. Maybe the first time when you went, you didn't use a proper way. That's why we didn't pass your exam. So this time, say myself, say yourself, okay, this is the way I'm going to study. First of all, I'm going to restart for my nursing fundamental. Don't say, oh, nursing fundamental, I don't need them, stuff like that. No, you need everything. Okay? So start from your nursing fundamentals. Like I always said to my student, I'm coaching online, leave all the difficult subject, you can review them at the end. For example, cardiac, maternity, mental health, and pharmacology. Leave these 4 subjects, okay, topics. You can review them at the end of your review, guys. When you start, you can start with, like, you know, delegation, prioritization, care management, nursing ethical and legal issues, infection control, safety, and you can start from there like that. And at the end, you can do, like, you know, cardio, maternity, mental health, and pharmacology. You can leave this for to review at the end. Okay? But if you start with the most difficult topic, you will not even feel comfortable to read your stuff, to review your notes, and which is not good. And the other issue with you guys, ever using like 3-4 resources for your Nclex. For example, let's say you buy like this bank. Okay, this bank probably has 1,000 or 2,000 questions. Okay, and then you go buy another banks, another 1,000 or 500 questions. The questions, the way they ask you are not the same. They are completely different when you compare these two apps. Okay, and you buy another like place banks again. Okay, so you messed up your brain. Don't do it that way, because you already memorized those questions in the first few banks and then the second few banks. So how many questions you gonna memorize, guys? Don't mess up your brain like that. If you have, for example, UWall is really best. You can use UWall. You can use boot camps. Like for my student, I have UWall for them, for PN, and then for RN, they can use boot camp. Okay, they can use my own account. If we're using a lot of sources, guys, which is gonna affect your brain, just keep at least one. Okay. Okay, like I said, so this book is available at careforallcadou.com, guys. Okay, let me remove this for you. And okay, so let me find. Let me see what this is I have here. And for example, let me show you the way you're supposed to study. Okay. Let's say you are studying cardiac disorder, okay? Cardiovascular. Okay. I'm just giving you an example. Okay? Okay, no, that's for neurological. Okay, let's say you are doing your neurological disorder system. Okay, ensure you do everything. For example, this is everything you need to know for neuro system, Alzheimer, okay, ALC, autonomic dysreflexia, Bell palsy, brain tumor, coma, encephalitis, Guillain-Barré syndrome, head injury, traumatic brain injury, hydrocephalus, ICP, intracranial pressure, meningitis, multiple sclerosis, MS, and Parkinson, so whatever disease here. So you need to know all of this for your Nclex. Okay? When you finish studying everything for your neurologic system, okay, then you're gonna do questions for neurologic system only. And I give you a free book when you purchase my book online at careforallcadou.com. I give you almost 600 questions free, guys. Okay, prioritization questions for each system. First, try to finish one system at the time. Ok? Bat pou fini yon system. Fin fè yon system. Kou fini, kou na wal fè question sou li. Ainsi de suite. So at least for neurologic system, you need to know all of this. You're not gonna get everything. Probably they can give you one case study, like probably on spinal cord injury, stroke, and any of them. You don't know those. That's why you need to prepare, guys, for them. Okay, so you prepare for everything. Let me see. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20. Okay, total 20 topics for neurologic system disorder. Okay, So when you're done, then you can do questions about neurological system disorder. Okay, I don't know, I cannot bring my book here. Hopefully I can. Okay, so let me see. Look at my book. I hope I can bring my book here, but I don't know if it's gonna allow me to do so, guys. Let me check something if it's gonna allow me to bring my book here. My book, this is my book. I don't think so. It's not gonna let me, guys, to bring my book. Okay, so sous besoin livre ça, allez dans careforall.cadou.com. If you need my book, go on like careforall.cadou.com. This is one of the best book, guys, ever you never met in your life. Ok, ou pa jam ou un livre kon sa nan vie ou. Paske livre lan, li gen tout so gen bezwen la dan, maladi an li tout, montre ou everything ke ou bezwen. Ou pa bezwen al utilize ton livre ki pou fè tèt wap formal. Ok? I was trying to bring, I don't remember, let me see this one. And I have to remove this. Oh, I was supposed to remove this picture. Okay, remove, yes. And let's say, guys, if I put this picture. Okay, so this is about maternity. So maternity review, history and assessment, and Nclex focus. I just put directly what you really need to know about maternity assessment. Okay, I just put whatever you need to know. For example, number 1, you need to know so what this mnemonic stand for. GTPAL. Okay, so G stand for gravidad, total pregnancies. T, term birth. Okay, less than 30 weeks. Okay, no, terms birth. Okay, 37 and plus terms, but for preterms 20 weeks, I can say 20 weeks to 36 weeks. And A stand for abortion. How many abortions, or less than, I can say 20 weeks. Because when you go for your first visit, they're gonna ask you. They're gonna ask the mother, so how many pregnancy, like abortion, stuff like that. They're gonna count them for pregnancies as well, even they are not living with you. And then L, living children. How many children living with you right now? Okay. And then number 2, usually they ask you when was your last date of your period. They always ask you when you go to see like, you know, your family doctor, and they always ask you when was your last date, okay, of your period. They always ask you these questions in order they can have, like, you know, they can have a due date they expect for you can be deliver your baby. And so Nclex pregnancy equal 40 weeks, which is 280 days. But if more than 40 weeks, you know, it's a late pregnancy, we call that, if it's more than 40 weeks. Okay, so everything is in my book like this, guy. If you buy my book, you're gonna see everything like this. Okay, anyway, guys, so I'm leaving right now because I finished my live on TikTok more than 4 hours. Okay, and then well, I just pass here to just show you. So how my book works. So if you buy the book, you will see everything like that. So whatever disease, you will see the disease itself, the definition, causes, signs, symptoms, risk factors, complications, the pathophysiology of the disease, and nursing intervention, Nclex priority, and treatments for your patient. Okay, you can go online right now to buy the book, guys, at careforall.cadou.com. I'm leaving right now, guys, because I'm been live, oh my god, almost 6 hours, 4 hours, 4.5 or 5 hours on YouTube, no, not YouTube, on TikTok. Yeah, but I was trying to show you how my book looks if you're interested to buy it. But it's a good book, guys, and my book will be available soon on Amazon. Okay, so my book will be available soon on Amazon. Okay, so if I could take this thing, okay, I can add it here. Let me put, what is the name? Save as. Hold on, guys, I'm going to show you. I'm going to show you. And next, and I'm going to show you something. You're gonna enjoy my book, guys. It is straightforward. No headache, no stroke with my book. Okay. I think I had this thing, but I was looking for it, so it didn't show. Okay, I'm gonna show you. Give me 1 second, guys, because I remember I have them. That's this thing. Okay, guys, for example, let me take another disease. Okay, let me take another disease. Let me remove this one. Okay, let me put another disease. For example, let me pick one. You're gonna really like my book, guys. Where is it? Okay, this is about. Okay, let me take this one. Okay, so, but in my book I do it each separately, guys. Okay, this is about bipolar disorder. Okay, bipolar disorder. You see, exactly, this is how I do my book. The definition. So what is bipolar disorder? What are the signs, symptoms, and Nclex priority. Okay, what are the priorities? Okay, so this is exactly I like, you know, my book, guys, inside my book, exactly the same way. Okay, And I think I put some case study too. I put some case study. For example, this is a short case study. Okay, let me remove this first. Okay, for example, this is a short case study. You know, sometimes some student guys not unable to answer the questions because they don't know the pathophysiology about the disease, and they don't know for this disease what is the priority. So you need to know that, guys. For example, this is a case study, short case study. It doesn't have a lot of questions. Let me make it bigger like this. You can see properly. Let me see if you can see. Okay. So you have a 2-year-old child arrive at the ER with fever and 99.5 degrees Celsius and 103.1 the Fahrenheit. Barking curve, respiratory stutter, hoarse voice, restlessness, and anxiety. And these are the vital signs: heart rate 150, respiration 38, and auto saturation 92 on room air. Okay, so they ask you what is the priority nursing action. Okay, what is the priority nursing action? The first thing, what is the priority? You can do other care for your patient, but they ask you the first thing you're gonna do right now to save your patient's life. Okay? And what happened again with some students, they don't know what type of theory they can use. For example, I have a total of 4. I will show you after this slide, guys. You need to know the question they ask you if you need to use your nursing process, which is ADPIDE: assessment, diagnose, plan, intervention, evaluation. And also you need to know if the question they ask me I have to use, for example, a Maslow theory. Okay, or if I have to use a safety or ABC, airway, breathing, circulation. So you need to know these 4 before you answer any question, and then always read your question first to see what they ask you. If you're gonna read all the scenario they put on your case study or your question, you're not gonna make it. Always try to read the questions. Okay, for example, that was the question they asked me: what is the priority nursing action? And now I go and I read my stuff. A 2-year-old, blah 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 blah, stuff like that. The first priority, you will just place the child in high follow. And when you do something, you need to know the rationale behind it. So why you do this for your patient? So reason you put your patient in high follow in order for, like, his lungs to expand, and then air can penetrate properly, and then your patient will be able to breathe properly. Okay, so that is the reason you do this one first. You can still do other things. You can still run out, like, run somewhere else. You go, for example, to get a oxygen machine, yes, to connect. Okay, if the one in the room is not working properly, sometimes they have them in the hospital on the wall. Okay, so let's say there's none. So what you're gonna do, you're gonna run for a oxygen machine. By the time you can just, the first thing, you can just, elevate the head of the bed, 90 degrees, high follow position. And guys, as soon as you see those words, okay, think about immediate action during difficulty swallowing, possible epiglottitis, risk of sudden airway obstruction. So do something right now to save this child's life. Do something to save his life. Right? Do something. Nclex priority words. If you see in a question they say priority, first, immediate, pause, most important, avoid, okay? And I have a list for you. I have a list words. You need to know them when you go write your exam and you see those words. Now you're gonna know this is an emergency, guys. You need to act ASAP, okay? As soon as possible. Nclex focus, pediatric airway emergencies. Safety before diagnosis, please. Keep child calm and upright while you are doing other thing, but at least you need to keep the child calm and upright. Keep the child calm and upright, guys. Okay? Let me see if I see those words for you I just mentioned. You need to know those words. I put them in my book for you. If you purchase my book, you will see them, guys. Okay, let me see. I can show you, and after that I can just leave. Okay, this is about, okay, obs. Okay, this is about obs. Okay, let me save this one. I will show you something how to make your life easy while you're studying medication. Oh my god, it's already 11:01. Time goes very fast, very fast. Okay, what else I have? Okay, I want to show you those words, guys. You need to know them. I'm telling you that as soon as you see them in any case study or questions, you will know what they mean for you. That means there is an emergency. You need to act as soon as possible. Okay, I'm checking. Okay, so this is the first list I just find for you. I find this for you. I'm going to show you. I think I have another one. And I think I have more than that. Save as. Okay, I think I have more than that, guys. Okay, immunization. So I just save them when I need them later for my TikTok live. I can have them ready. Okay, I think there's no more. Okay, this is medication. And so I'm come back, guys. Please subscribe my YouTube channel and leave your comments. You can tell me which topic would you like me to discuss for you. I do speak Creole, guys, and speak French too, and little bit Spanish. So, ou kapab ekri an ba live lang. So, key topic. Okay, I think this is the second one, guys. I'm going to show you. But I remember I put everything together. Okay, this is the last one. Let me check my thing here. Let me check. I remember I put everything together. Let me. So I'm looking for it. It was here. Oh, this is what I was looking for. Where is it? It was this one. No. I'm going to show you guys what I was talking about. I think this one. Okay, yeah, I find it, guys. Okay, this is very important. Let me send it to my email and I can have it. Okay, I'm going to show you before I end my live. Let me see, inbox. Okay, it's already come. And download, open it, save as. Okay, so each student needs this, guys. I'm telling you that each student needs this. Okay, let me show you what I'm talking about. Okay, let me remove this. I can show you. Each student needs this for Nclex exam, guys. Let me show you. We'll see. Wait, where is it? I think this one. Okay, yeah, here we go, guys. So each nursing student needs this, guys. Here we go. You need to know when you see those words, okay? You need to act as soon as possible. If you see a question in the question, like start, immediately, right away, alright? Urgent, rapid, live, threaten, okay? No delay. Act, okay? Act, guys, as soon as possible. Act. Quickly. What about for airway and breathing? Red flag. Oh my God. Stutter, choking, urgent, drooling, gurgling, emergent, respiratory distress, severe shortness of breath, use of accessory muscles. Oh my God, especially in asthma patient. O2 saturation less than 90, unless if your patient is a COPD patient, chronic obstructive pulmonary disease, no problem, because the normal range for them between 88 to 92%. If I have a COPD patient, no problem, but my patient is not on COPD, then I need to do something to save this patient's life. And cyanosis, circulation, shock words, hypotension, tachycardia, hypovolemic shock. For neuroemergency words, you need to know unresponsive, seizure, decreased LOC, acute confusion, stroke symptoms, okay, chest pain, pressure, ST elevation. Do something right now for your patient, otherwise your patient will die, guys. So do something for your patient. Cardiac red flag, chest pain, pressure, ventricular tachycardia, act right now, and more. Or if you're about, like, new onset arrhythmia, do something. You need to know those words, guys. when you see them in a case study, in a question, you say, oh, there is a priority here. I need to act right now. I need to act right now. You need to provide care right now to your patient. Infection, sepsis word, high fever, hypertension, ST elevation, VTAC, new onset, stroke symptoms. Okay? Then, Nclex strategy box, guys. ABC before everything. ABC before everything. ABC before everything. Airways, breathing, circulation. Life, comfort, acute and chronic. Then, I have to take care of my acute patient first, because chronic, if I have time, I will check on my patient. So my patient be diagnosed, like, let's say, with asthma for more than 20 years. Okay? But I have a patient, for example, shortness of breath, so I have to take care of my shortness of breath first. What about if I have a low blood volume patient, hypovolemic shock, and I have a shortness of breath? Which one will be your priority? Your hypovolemic shock. I know some of you will say, no, the breathing. Hey, the patient's bleeding, guys. This is your first priority. Because if you don't solve this issue, if you don't provide care, so your patient will end up with cardiogenic shock. Because with hypovolemic shock, low blood volume, decreased oxygen, heart rate, and respiration are very high, because they try, like, to recompensate the body. So your hypovolemic shock supposed to be number one, and after that you can go for your shortness of breath. I know some of you gonna say, hey, airway breathing first, airway first. No, your hypovolemic shock. And actual and potential. You need to treat your actual right now. So you need to know these words, guys. They are very important for before your exam. If you buy my book, so I put them in my book for you. So when you see them, you can recognize them. Okay? In your exam. Anyway, guys, so I'm leaving you right now. It was a pleasure. Buy my book online at careforallcadou.com, and also subscribe my YouTube channel. Leave a comment. Just tell me, so which topic would you like me to discuss? Creole, French, or English? It's up to you. Okay? So si c'est anglais, si c'est créole, si c'est français, ou t'as aimé pour moi, fait topic là pour ceux qui te yon comment en bas vidéo. Ok? So c'est comme ça toutes mes maladies yo ye. Ok? Si par exemple moi t'apprends ça, comme ça c'est tetralogy of Fallot. Okay? So if you buy my book, you will see like this. Tetralogy of Fallot. What is this? Okay? You know the 4 defects. They are here. And this is the picture it shows you about them. And if you want to read more, I have another book just for reading. But some people, like, who are visual learner, they prefer this book instead of reading a lot of stuff. I'm a visual learner, I prefer this book. Okay? A key Nclex points to know, guys. So it was a pleasure, guys. Bye bye. See you next time. Bye bye. À bientôt. So, capable quitter yon comment en bas live là. OK? Pour dire qui topic ou t'as aimé vraiment connaître, m'ka faire en anglais, en créole pour. Ok, so qui ça qui bon problème? Est-ce que c'est ECG? Est-ce que c'est EKG? Whatever topic. Toujours dis ça, pas qu'à faire quoi, boire dit corps difficile encore. C'est parce qu'on pas comprendre, pathophysiologie, ou pas qu'on jamais maladie elle manifeste, ça faut dire difficile. But they are not difficult, guys. Bye bye. Bye bye, guys. Take care. Bye bye. Okay.